Hello, I'm Faith, and today I will be doing a discussion about hemodynamics. So, hemodynamics is the body regulating blood flow and pressure within the heart and blood vessels, and it helps us to understand how the heart pumps blood and how the vessels will distribute it to the tissues. So, key structures involved in hemodynamics are the heart and its components, like the ventricles, which they are the main pumping chambers that generate pressure, the atria, which receives blood pressure, receives blood returning back to the heart, the heart valves, which they ensure that blood flows one way. And then there's also the myocardium, which is the cardiac muscle that is responsible for contraction. So that's important because cardiac contraction determines stroke volume and cardiac output, which are primary hemodynamic variables. Blood vessels and blood are also important structures involved in hemodynamics. Blood vessels will regulate pressure and flow. Some components to blood vessels are arteries, which they carry blood away from the heart and have thick muscular walls inside them to maintain that high pressure. There's arterioles, which control blood flow to tissues through vasoconstriction and vasodilation. Capillaries, which are the site of where there's oxygen, nutrients, hormones, and water, and how they move from blood to the tissues. And then finally, there are veins. They store large volumes of blood and return blood back to the heart. Blood itself contributes to hemodynamics through viscosity, which is the thickness, volume, and then hematocrit, which is the percentage of red blood cells in your blood. And then hemodynamics is basically described by several measurable variables like cardiac output, which, as we know, is the amount of blood pumped per minute and can be calculated by multiplying heart rate by stroke volume. Blood pressure is also a variable, and it is calculated by multiplying cardiac output by systemic vascular resistance, which is the resistance created by the arterioles. So there are some major physiological laws that explain hemodynamics, starting off with Frank Starling law of the heart. It states that the greater the preload, the greater the force of contraction and stroke volume will be. And it's important because it explains kind of how the heart automatically adjusts to output to match that venous return. Fick principle is also one, and it is used to calculate cardiac output based on oxygen consumptions. And it just basically means that cardiac output equals the oxygen used by tissues divided by the arteriovenous oxygen difference. There's also Pucell's law, which explains how vessel diameter affects blood flow, and then states that if there's a small change in the vessel radius or diameter, that it will change blood flow. And finally, there's also Ohm's law of circulation, which is measured by flow by dividing pressure. It measures flow by dividing pressure and resistance. So exercise has strong influences on hemodynamics through immediate and long-term mechanisms. So during exercise, the cardiovascular system must deliver oxygen to working muscles. So several hemodynamic variables will change with exercise. There'll be an increase in cardiac output, and since heart rate and stroke volume both increase during exercise, that cardiac output is affected. But that follows what Frank Starling's law of the heart states, that where increased venous return is that they'll be stretching the ventricular muscle fibers in return, producing a stronger contraction and a greater stroke volume. Exercise also redistributes blood to tissues that need oxygen the most. So during acute exercise, muscles extract more oxygen from the blood, and this process is described by Fick principle. As far as the long-term effects, there are improvements in lower resting heart rate by increasing that parasympathetic tone and decreasing sympathetic activity at rest. Chronic training also improves the heart's pumping ability by increasing stroke volume through increased left ventricular chamber size, increases in myocardial contractility, and then greater end diastolic volume. Improved vascular function and health will also be shown by increasing capillary density in the skeletal muscle, improvements in endothelial function, and enhancing nitric oxide. Long-term exercise will also improve oxygen utilization through adaptations such as mitochondrial density, increase oxidative enzymes, and increase capillary networks. So hemodynamics is really important in clinical exercise physiology, especially in programs like cardiac rehab, being able to understand how blood flows through the cardiovascular system, and then how clinicians can use it to design a safe and effective program that will improve the patient's cardiovascular function, endurance, and overall health is really beneficial. So monitoring those variables that are involved in hemodynamics, like heart rate, blood pressure, cardiac output, and then perceived rate pressure product, will ensure that they can create those safe and effective programs. Since these variables also determine if the heart is responding properly to exercise, it can allow clinicians to monitor their disease progression as well as their recovery from their cardiovascular conditions. It also allows clinicians to be able to track the patient's physiological improvements, like improved cardiac function, improved vascular health, improved blood flow, and improvements in oxygen delivery from their time in cardiac rehab. But improving these physiological mechanisms through exercise interventions and cardiac rehab can enhance cardiovascular health, physical performance, daily activities, and improving overall quality of life. As far as research on hemodynamics, there is consistent active research on hemodynamics. There's also some technologies that have affected how clinicians and exercise physiologists can monitor and improve cardiovascular function. The most important emerging trend that I found was wearable hemodynamic monitoring devices. So those sensors can measure heart rate, blood pressure, stroke volume, cardiac output, and vascular resistance. And the one example that I found was a textile-based wearable sleeve that integrates ECG and impedance plethysmography, and it will measure all the values that I stated previously during their daily activity. And this could be important to cardiac rehab, because if the patient has graduated from their session of their program of cardiac rehab, it can allow them to continue training outside of the clinical setting while wearing these monitors to continue to track their responses to exercise and be able to detect any abnormal hemodynamic responses so that they can continue a safe and effective recovery at home.